Hello everyone, welcome to this channel. In my last video, I have talked about our urinary bladder. If you want to see that video, then click on the button and watch the video now. Today I'm going to talk about our continuation part of the urinary bladder, which is urethra. Okay, so as you can see in this photo, this is our urethra. So about this, you have to know a few points. That first, it is a tubular pathway. It's a tube-shaped pathway. Via this pathway, urine drains or is excreted out from our urinary bladder to the outside of the body. Okay. Number two, in male, the length of the urethra is longer than in female. Okay. Why? Because in male we have penis. Female doesn't have penis. Okay. That's it. Now I'm talking about male urethra. Okay. I will talk about female urethra later. In male urethra, you have to know that as I said, the length of the urethra depends on the length of the penis. Now, if I say average Indian size or the average Indian length, then it comes around 18 to 20 centimeter. The entire length of the urethra in average Indian male has 18 to 20 centimeter. If you consider global ratio or global population, then the range starts from the 15 centimeter to the 25 centimeter. Okay, because you have to consider Asian peoples and African peoples. Okay, now if I divide our urethra into two segments, it will come into posterior and anterior segment. First few centimeter, 4 to 5 centimeter remains in posterior segment, and the rest of the entire length remains under anterior segment. Okay, now entire pathway of the urethra, it has two bend. Okay, one bend at the bulb of the penis and next bend at the flaccid point of the penis. Okay, I will talk about these things later. Now listen very carefully. Our urethra starts at the level of the neck of the urinary bladder. Okay, or you can say the internal urethral orifice, or you can say internal urethral sphincter. Okay, in these three you can say anything, whatever you want. Now here the point is, when it starts, it goes straight downward and it pierces our prostate and it exits downward. Okay, when it goes downward and it flips forward, it goes anteriorly towards the penis. It enters in the penis. Now I'm talking about the posterior part. Here's the thing, I have nothing to make you understand. Suppose this is the brush. Okay, and consider this fist is a prostate. Okay, so this is urinary bladder, and at the level of the neck, this urethra starts and it descends downward, and it pierces our prostate. Okay, it pierces our prostate and it exits the down part of the prostate. Okay, or the inferior surface of the prostate. I will talk about this prostate later, not now. So think this entire toothbrush as a urethra or posterior part of the urethra. So above part of the prostate we call it preprostatic part. Okay, the segment which remains inside the prostate we call it prostatic part, and the lower point is covered by our bulbourethral gland. Anyway, I will talk about this later. So this lower part of the prostate, so the lower part of the urethra which remains outside the prostate we call it membranous part. Why? I will talk about these things later. And after this posterior segment of urethra, we come into anterior segment of the urethra. Anterior segment is divided into two parts. One is bulbar urethra and another is pendular urethra. Okay, see the bulbar urethra, what happens when this urethra comes out of the prostate and after a few centimeters it flips forward and enters towards the penis. Okay, it enters towards the penis. What happens at the base point, it is covered by bulbous spongiosum muscle. It is very specialized muscle of penis. I will talk about this later. And so this part which is covered by bulbous spongiosum muscle we call it bulbar urethra, and the rest of the segment we call it pendular urethra. Why? Because our penis hangs like this when it is flaccid, or whenever it's erected it dangles. Okay, so like a pendulum, so we call it pendular part. Anyway, now preprostatic part of the urethra, as you can see in this photo, the length of this part is 1 to 1.5 centimeter. Okay, and it is covered by internal urethral sphincter. Okay, so it starts at the level of the neck of the urinary bladder where the internal urethral orifice lies. Okay, at this point three things you have to remember: internal urethral orifice, level of the neck of the urinary bladder, and it covers by the internal urethral sphincter. Okay, why this sphincter presents? Because when the urine outflow comes at the end, this sphincter gets closed. Why? Because the rest of the urine never go back. I mean, it prevents the retrograde flow. Okay, so the entire urine finishes by the dribbling. Okay, by tip 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 dribbling. Okay. Number 2, during ejaculation, when the sperm goes out of the penis, this internal urethral sphincter close. Same cause to prevent the retrograde flow. The destination of the sperm is only outside of the body, not inside of the urinary bladder. Okay, so to prevent the sperm flow to the inside of the urinary bladder, this internal urethral sphincter closes. So the rest of the sperm has to go out of the penis. That's it. Now one thing you have to see, suppose I am coming closer. Now see one thing. If this is entire urethra remains in the prostate, which is the prostatic part of the urethra, so this wall of the prostatic urethra is the anterior wall of the prostatic urethra, and this is the posterior wall of the prostatic urethra. Okay, this posterior wall has a midline ridge. As you can see, this ridge is known as urethral crest, and on each side of this crest you will find a shallow depression or dampened area where the prostatic ducts opens. This area we call it prostatic sinus. So almost 15 to 20 ducts you can see in this opening, and in this midline of the urethral crest, you will find a elevated area. We call it Verumontanum. It's very, very important, also known as colliculus seminalis. It's a slit-like orifice where the prostatic utricle open, and below to this prostatic utricle in both sides you will find 2 opening of the ejaculatory ducts. Okay, now through these ejaculatory ducts our semen comes from the both testes. Okay, also in this photo you can see the membranous part of the urethra, which is almost 1.5 centimeter. It is the shortest and the most weakest part of the urethra, and especially it is covered by external urethral sphincter. As you can see in this photo, that the anterior segment of the urethra, see the bulbar urethra is almost 1 to 2 centimeter. Okay, because it is covered by our bulbospongiosum muscle. It's very, very special muscle, and the remaining part of the urethra remains inside of the penis, covered by bulbospongiosum and corpus spongiosum muscle. Now the blood supply. In blood supply you will find 2 segments. One is arterial supply, venous drainage, same as all. In arterial supply you will find 2 components. First, our urethral artery, which is a branch of our internal pulmonary artery, gone. Next part is our circumflex artery, which is a branch of our dorsalis penis artery or dorsal penile artery. Okay, gone. In the venous drainage you will find the dorsal penile vein, which drains into internal pudendal vein, which drains into prostatic venous plexus, which drains into internal iliac vein, gone. Okay, and the posterior part of the urethra drains via prostatic and vesicular venous plexus, which also drains into internal iliac vein, gone. Now in the nerve supply you will get sympathetic and parasympathetic component. Sympathetic component you will get from the greater cavernous nerve and prostatic nervous plexus, gone. And the parasympathetic you will get from the S2, S3, S4, gone. Okay. Now our female urethra. Female urethra, as I said, is 4 centimeter long. I mean almost 4 centimeter in length, and it runs antero-inferiorly. Okay, from the level of the neck of the urinary bladder to the opening of the external urethral meatus. Okay, you have to remember that almost 2.5 centimeter behind the clitoris and almost 1 centimeter entry to the vaginal opening. In middle of this point you will get the urethral opening in female. Okay, now also as you can see in this photo, that 2 minor, very small paraurethral gland, or the duct of the paraurethral gland opens into this external urethral meatus in female, and this 2 gland is also known as Skene's gland. Okay, now in female, the arterial supply you will get the superior vesicular artery and few branches from vaginal artery. That's it. And in venous drainage, few urethral venous plexus and also few vesicular venous plexus combinedly enters into the internal pudendal vein, and this internal pudendal vein drains into the internal iliac vein. Gone. And in nerve supply of female urethra, all sympathetic and parasympathetic comes together from S2, S3, S4. Done. Finish. Now, one extra knowledge point, you have to remember that in male urethra, we have two sphincter. One is internal urethral sphincter and external urethral sphincter. Internal one we cannot control. It is our motor system. Okay, I will talk about this mechanism in later in physiology chapter, not here. In external urethral sphincter, we always control. Okay, suppose the volume of the urine has gone beyond 500 ml. I have intense pain. I have to go to pee, but I can control the urine outflow by controlling or the squeezing the external urethral sphincter. And in female, here is the most interesting point. Female do not possess internal urethral sphincter. They do not have this. They have only and only external urethral sphincter. That's it. So this is all about our urethra anatomy in male and female. I hope you liked it, and if you liked it, then subscribe and share. Till then, bye.